3 minutes to 2 o'clock. Welcome back. This is the Midday View on eNCA DSTV channel 43. In fact, it's the first hour of the Friday edition. Now, the Health Minister, Dr. Joe Phaahla, announcing that from Monday next week, children aged between 12 and 17 years old can register for their COVID-19 vaccine. She's not a teenager, but she's following the story, and she's here in the studio this afternoon. Heidi Giokos, you look like a teenager.
Good.
I need to make sure I'm in the good books here. Heidi, seriously though, I thought we would expect that by now, as the rollout goes, the country will begin to cover those who are younger. I mean, we've moved from the 60 plus and the rollout has gone like that. So nothing really surprising there. But what does it all mean?
Yes, so nothing really surprising. Government was expected to move into this space and start rolling out the vaccine to those that are 12 to 17 years old. And this is obviously because globally you are seeing the vaccine that's being approved for the younger age group. So government, of course, found it necessary to also consider this, and the medicine regulator saying it's safe for those between 12 and 17 to get their COVID-19 vaccine. What's interesting, though, Dan, is the fact that we understand government says those between 12 and 17 will be able to get their vaccine, but only one Pfizer dose. So instead of getting 2 Pfizer doses the way we've been vaccinated, they'll only be able to receive 1 Pfizer dose. And government's indicating the reason for this is because they believe 1 dose provides enough protection and sufficient protection for those between 12 and 17 years old, but also mentioned by the Health Minister that there is slight concern about possible side effects. We do know that there has been some cases with heart inflammation when it comes to the Pfizer vaccine, but very, very rare cases have been reported. But of course, government needs to be on the side of being cautious and rather being careful when it comes to that. But let's listen to the Health Minister on more details on this.
This service will start on the 20th of October to allow the necessary preparation on the EVDS registration system and also other logistical preparations. We believe that this will come handy as schools start their examinations, or some of them are already advanced towards concluding their academic year and are starting to prepare for the next academic year of 2022.
So will these children need parental consent?
No, according to the Acting Director General of the Department of Health, Dr. Nicholas Crisp, he said that according to the Child Act, those between the age of 12 and 17 do not need consent from their parents. They can go to a vaccination site, they can register on EVDS at the vaccination site, and they will be able to get their vaccines. What's also important here is that many questions were raised about whether or not this is going to be rolled out at schools, and the Department of Health saying that is not in the pipeline for now. They would rather have those between the age of 12 and 17 who want to get the vaccine to get themselves to a vaccination site. So let's listen to the Acting Director General on that.
In terms of consent for children, so the Children's Act makes provision for children from the age of 12 to 17, in other words, not yet adults, to give their own consent for medical treatment. And there are provisions within the sub-clauses of the Children's Act that explain which children can give consent for what. So children do not need their parents' consent generally for any medical treatment, and there are specific guidelines on that. But parents can give consent for their children to get vaccinated. So it is possible for a child to go between the age of 12 and 17 to go for vaccination at a health service without their parents' consent. That's another reason why the school health program is not being used at this stage, because there's an agreement, a multi-party agreement between health and education and school governing bodies around how consent is given and how they are vaccinated in the school health program. And as I said, that's something we will deal with in a long and ongoing process later.
Heidi, just last final question that just popped up in my head. Do we know, you said one Pfizer jab, okay? In South Africa currently, we don't have lots of vaccines, but we've also prioritized the J&J, which is a one dose, for rural and remote areas, because this thing of traveling to and fro for them is not working. In rural South Africa, if there's a young one between 12 and 17, will they get the J&J or they'll also get the Pfizer? What do you understand?
So from my understanding, they will also get the Pfizer vaccine, and this is because the Department of Health will make sure that vaccination sites provide the Pfizer vaccine. And it's, of course, because the medicine regulator has only approved Pfizer for the age 12 to 17.
Okay.
So
Professor Dr. Helen Rees and her team have said, no, only the Pfizer for 12 to 17.
Yes, so the research and the studies that have gone into this have only been approved for Pfizer vaccine for those between the age of 12 and 17, and it's only one dose for now.
Okay.
So moving into the space of J&J for that age group is, of course, not possible because it,
only Pfizer.
Only Pfizer.
The regulatory authority that's headed by Helen Rees, by the way. That's why I was mentioning her name. Thank you very much, the one who looks like a teenager, for sharing that information about the next group to be vaccinated, our teenagers aged between 12 and 17, and they can only get one jab of Pfizer, one dose of Pfizer, and that's it. Now,